Did you know sickle cell disease affects approximately 100,000 people in the United States? Symptoms can range from severe anemia to heart and lung problems.
But who does it affect? And here to explain is Dr. Idowu, medical director at UT Physicians, along with patient Ms. Hoxi Jones, who was diagnosed with sickle cell disease at just age 3. Ladies, welcome to the show.
Thank you.
Thank you so much for being here. Doctor, let's first talk about sickle cell disease. Who does it affect?
So it does affect 1 out of 365 African-American births. So babies are born, 1 out of 365 children are born with sickle cell disease. Also, 1 out of 16,000 Hispanic American babies are born with sickle cell disease. Now, the sickle cell trait itself affects 1 out of 13 African-American people in the U.S., but it affects millions of people worldwide. Most of these people live in the sub-Saharan African countries and also in the Mediterranean continent.
1 out of 13, so the percentages are huge. Ms. Hoxi, you are one of the folks affected by this disease, diagnosed at age 3, and I understand doctors did not expect you to live a full life.
Yes, my target age was 20. That's what the literature said back then. But thankfully, through medical science and good care from physicians, I've been able to, beat those odds.
You look great and you look healthy. Can you describe to us some of the symptoms, though, like how your body has reacted to this, just to help us all have a better understanding?
Well, when we have a sickle cell crisis, that's when we have the severe pain. It feels like taking a shard of glass and scraping out the inside of the bone marrow. And so when that happens, that's when I seek medical care. And sometimes it can result in just an emergency room visit. Sometimes it results in hospitalization. So it just depends. And over the years, it impacts your body. It has a toll on your body. So your organs are impacted as you grow older. I've been blind in my left eye from sickle cell. I had sickle cell retinopathy, and so I'm going to have laser surgery in my right eye because there's a bleed going on right now, and so those kind of things, happen.
And you're living with this disease, and I think that's the big story. Of course, your road to getting where you are, you've had complications and surgeries and other things happen. But doctor, that's the important thing, is that,
yes,
the diagnosis now is changing. People are living with this, but this is an inherited blood disease.
Yes, yes. So it basically causes the red blood cells to be sickled in shape. And what that does is that it sticks to the blood vessels wherever blood flows. And it decreases the flow of blood to these organs, to all of the organs basically, and the decrease in oxygen supply. When this happens, patients can have severe pain. This we call pain crisis. They can also have organ dysfunction in basically any organ in the body. That's why she was talking about eye, problems. Patients can have problems in their spleen, so they don't have functioning spleen, so they're not protected against many infections. We have to keep them vaccinated against meningitis, pneumonia, many other things like influenza. Patients can have strokes right from childhood. They can have kidney problems, liver problems, heart problems, lung problems. They can have multiple organ failure in the hospital. So this is a big problem.
My goodness.
Yeah.
And hearing you talk about some of these issues and seeing that list we just put up on the screen, I think a lot of people probably feel extremely overwhelmed if they or a loved one are dealing with this. So doctor, talk a little bit about some of the treatment options for someone with sickle cell.
So basically the treatment options are focused on management of the symptoms of sickle cell disease. The reason being the main cure of sickle cell disease is stem cell transplant, but this is a very dangerous procedure. It has many risks, including death. So it is something that we don't like to do in adult patients. And even in pediatric patients, the donors are very limited, so patients don't have donors available. And when patients go through it, they have all these complications, infection, and many other issues to deal with. So normally we tell our patients to make sure they keep themselves well hydrated, avoid extreme temperatures. Too hot, too cold can get them in trouble. They do need to avoid getting too much stressed out. High altitude can cause a problem. So we basically just try and prevent complications and manage the symptoms. When they get in crisis, we do hydrate them, treat the pain with opioid medications.
And the diagnosis, though, does come at the pediatric level, typically, correct?
Yes. So now in the United States, since 1980s, all newborns are screened at birth for hemoglobin abnormalities, which includes sickle cell disease. So when she was born, that wasn't going on.
Right.
Because she was born way earlier than 1980s. But fortunately, in the U.S. now, everyone right from childhood will be diagnosed. However, the sickle cell trait patients may be missed because their parents might have been told that they have trait, but they may not know that because they don't have the disease. So the trait patients may be at risk of having children with sickle cell disease. And those are the ones that is 1 out of 13 African-American births or babies.
We are tight on time, but I do want to point out that UT Physicians, there's the Comprehensive Sickle Cell Center, and this is the only family sickle cell center in Houston. So essentially, lifelong care for patients, and this is a place for families and patients to go in, be treated, and be comfortable.
Correct.
Hoxi, you've experienced this.
Yes, and it's the place to go if you need care. If you have sickle cell disease, there's no other place really in Houston or in Texas that you can go to that has a specialist, and they are expert in the care and treatment of people with sickle cell disease. Even though many women will bemoan their white hair, I say it's a testament to my longevity. I'm 65 years old, and part of that is due to the care that I receive from Dr. Idowu and the UT Physicians Comprehensive Sickle Cell Center.
Amen.
Hoxi Jones, thank you so much for sharing your story. Glad to see you doing well. Dr. Idowu, thank you so much for stopping by as well. And if you would like more info or to schedule a consultation at the location nearest you, just visit utphysicians.com, or you can give them a call at 888-4UT-DOCS.
Thanks, ladies.
Thank you very much.
All eyes are on the forecast.